Dr. Jamal Rifi is a GP in the Canterbury-Bankstown LGA, and Jihad is a Labor MP and local member for Lakemba. Thank you very much to both of you for your time today. You're both long-term residents of some of the most affected areas of Sydney. There are lots of theories about why COVID case numbers in Sydney are inching slowly upwards rather than coming down sharply during the lockdown. So let me ask each of you for your insights into that. Jamal Rifi.
Without any doubt, it is a combination of things. First of all, it is the virus itself. We all know that the Delta is highly contagious, it's more deadly, and transmit very easily. At the same time, the demographic in our area. We have large members of families living together under one roof. At the same time, the majority are tradies, construction workers, air condition repairers, plumbers. They need to do their work on a day-to-day basis, and they don't have the luxury of actually working from home behind their computers.
Jihad did.
Yeah, look, I think Dr. Jamal has summed it up pretty well. I mean, there's a range of things, but I think also the thing that people need to take into account is the fact that it is a very complex community. We know the highest concentration of people from all over the world. Obviously, there's a strong emphasis on a low socioeconomic status, and it means that people really do the kind of work that is essential work, the work that keeps all of Australia going. And, you know, there's many situations of families who, actually intergenerational families that live together, that don't have the luxury of being able to do the things that maybe some others can do. And I think, you know, you overlay that with other complexities, such as some language difficulties, such as potentially the need to put food on the table more than anything else. There's a lot of people who live here hand to mouth, and that's a really important factor.
So when we look at those factors, the demographics, the number of essential workers, people living together in close proximity with their families, language skills in some cases, can you see any gaps where authorities could sort of improve things to help get this situation under control more quickly? Jamal Rifi first.
Without any doubt, there are many gaps, but we don't expect just the authority to fill in these gaps. We are doing it ourselves because, first of all, they are our loved ones. They are known to us. We lived with them, and we need to give them the protection. So, like for today, we had 22 doctors of Arabic-speaking background. They wrote an open letter to our community that's been translated, published in all the newspapers, on social media, getting them to trust. They trusted us all these years, and they need to keep trust our judgment on this vaccination. And so we upped there. And at the same time, we knew that we needed a pop-up clinic. We put it to the government and state and federal. And to their credit, they bent their backwards trying to meet our need because we are on the ground, we know what needs to be done, and they are doing it. But things takes time.
Doctor, do you think that you're seeing a shift in people's attitudes towards vaccination and willingness to be vaccinated?
Without any doubt, there is a big change of attitude toward this Delta variant because of the variant itself, because it affected so many of us and it forced people to make changes into the way they perceived this virus. At the same time, right now we have more vaccines available, more drop-in clinic available, and it is in their own community, in their own street. So people are now rolling up their sleeve and getting the vaccination. Yes, big changes, and to be honest, I'm very confident we will get on top of it in the next couple of weeks.
Jihad, what about you? Do you see any particular gaps that could be addressed?
Yeah, look, I mean, there's a number of gaps, and certainly I think the first one was making sure that the pop-up vaccination clinics happened, and we've seen only in the area that I represent over the last week, just the pop-up vaccination clinics. These are ones that are run in community in partnership with New South Wales Health and the community themselves. And basically it's a, turn up, get your vaccination, no appointment required. There's been 5,000 done. And I think that's a really spectacular thing. And what's really important about that is that people go to a place that they trust, that they know, that's not as daunting, that's not as intimidating. And where I think the gap there is let's make more of these. Let's make these a permanent fixture, because we've actually got to take it to the people. I think having mass vaccination hubs is one thing, but you can't expect everybody to go to a mass vaccination hub. It works a lot better when a neighbour may say to another one, hey, I'm going to come down, will you come down?
Thank you very much to both of you for the work that you do in your communities and have done for many years, actually. And thank you for speaking to us tonight.
Pleasure. Thanks for having us, Leigh.
Hi, I'm Leigh Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.